Hi, I'm an information specialist for the Genetic and Rare Diseases Information Center, also known as GARD. If you or a loved one has been living with a condition that your healthcare providers have not been able to diagnose, you are not alone. Although GARD information specialists cannot make a diagnosis or give medical advice, we have written a guide called Tips for the Undiagnosed that answers many common questions. During this video, I will go over key tips from the guide to help you during your search for a diagnosis. GARD is a service for the public that is funded by two parts of the National Institutes of Health, the National Center for Advancing Translational Sciences, or NCATS, and the National Human Genome Research Institute, or NHGRI. You can find the tips for the Undiagnosed Guide on the NCATS GARD website under Featured Guides. This page lists the resources that I'll be talking about in this video. As you search for a diagnosis, it is important to keep seeing your primary healthcare professional for regular follow-up visits. He or she can keep track of health changes that might be clues that lead to a diagnosis. You may also want to ask about a referral to a specialist at a university hospital. Those sites likely have access to the latest technology and are often doing clinical research. NHGRI and Global Genes, a rare disease advocacy organization, both have helpful guides with tips for those with undiagnosed conditions. The Global Genes Guide is called Becoming an Empowered Patient, a Toolkit for the Undiagnosed. Other groups, such as In Need of Diagnosis and Syndromes Without a Name USA, often help and support people with unexplained conditions and their families. Another tip is to consider taking part in research. The NIH Undiagnosed Diseases Program is a research program that involves doctors from many specialties who work together to solve the most puzzling medical cases referred to NIH from across the nation. To learn more about this program, call 1-866-444-8806. The Undiagnosed Diseases Program is now expanding to include a network of academic medical centers across the country. There are also research studies that aim to make a diagnosis in various categories of disease. Being part of a research study may allow for more testing than your current healthcare provider can order. When you take part in a research study, it is important to ask if you will be given your test results. Other studies may be looking at how well a medicine works for a specific symptom. Even if the diagnosis is unknown, treatments may help improve your symptoms. You can search for studies that may be right for you by using the NIH website called clinicaltrials.gov or by calling the NIH Patient Recruitment and Public Liaison Office at 1-800-411-1222. Over time, the cost of many specialized appointments and tests can add up, so you may need financial help for medical care. In the Support for Patients and Families section of the NCATS GARD website, there is a list of resources for financial aid and to help with covering the cost of travel. One of these resources is the National Patient Travel Center, which can help you find free or discounted services for traveling to specialized medical centers for diagnosis or treatment. You can get help by calling 1-800-296-1217. More information about this service is available at patienttravel.org. We hope that these tips assist you in finding resources that help you during your search for a diagnosis. If you need more help, please contact a GARD information specialist.